Hello, everyone. Welcome again to another episode of Campus Conversations with Brother Ken. I'm Brother Kenneth Thomas, Health Superior of the Brothers of Mercy, and I'm here with my guest today, DPT, physical therapist, Doctor of Physical Therapy, Mrs. Lauren Grawe. Lauren,
Brother Ken,
good to see you again.
great to see you.
You know, you were gone for a while, so it's great to see you back. And I have to say, we were discussing this earlier, so I'm not only a sponsor of the nursing home, but I'm a client as well.
Yes, always.
Lauren is one of my personal therapists for when my back goes out of whack. So, you know, if I'm walking upright, part of it is thanks to Lauren and her team.
Oh, appreciate that.
No problem. So, Lauren, just sit back for the ride and...
Okay, I'm down.
I'll grab you by the hand. We'll
Buckle
go together.
my seatbelt?
Yes.
Okay.
So I kind of gave it away, but could you explain to everyone what is your title and how long you have been at the Brothers of Mercy?
I have been at Brothers 9 years, and I've been the director of outpatient therapy for 7 years in September.
So you worked an inpatient for a while before the clinic opened?
2 years as a regular PT, and then once the outpatient was starting to be constructed, I moved on over.
And in my book, there's no such thing as a regular PT.
True, very true.
Yeah. So yeah, so Lauren's been here. She must have came right out of grade school, right?
Yes, I'm very young.
We redheads have to stick together, right, Lauren?
Always.
So tell me about I don't know if we could consider yours the word average here, but an average daily routine for your position at the outpatient therapy clinic.
That's a loaded question because every day is different, which is, I think, why I like my job so much, because I have a whole host of things I could be doing. A typical day I come in, I could be treating clients, I could be going out into the community and giving a wellness talk. I could be in one of the campus buildings talking to our residents about our therapy program.
Assessments.
Assessments, yep.
Because I know well.
I'm on a couple committees, so my day is flexible and it varies and it keeps me on my toes.
Yeah, because you're also one of the chairs of our centennial celebration.
Yes, I am. Yep.
And good for you, it's winding down.
It is. It's been a long 12 months, but I think we've done a really nice job.
Yes,
of celebrating.
our committee's done a wonderful job. I couldn't have done without them.
Yeah.
Let me put it this way, if it was up to me, probably would have got done. So.
Well, you need good organizers, and
Yes.
Ashley and I are just that.
Good organizers. So what are the different types of therapy offered at the clinic?
So we have all three therapies, and for those that don't know, physical, occupational, and speech therapy. Our clinic it's kind of a niche of ours that we have all three, so people can come and actually spend 3 hours with us, whether they like to or not. Usually they need to, so our therapy is different than a normal outpatient clinic where you would just see normally PTs. So we have all different kinds of therapists.
Well, and I feel fortunate that I haven't had to use the speech yet, because after PT and OT, I feel like I need a long nap. So.
You know, I think we could all benefit from speech. A lot of people just think about talking, but a lot of us suffer from some memory issues, and they work on that too.
Memory issues. And
I know
even
my postpartum brain is not the quickest, so we could all get some strategies from Jess, our speech therapist, as well as swallowing issues. Those
you
can
have a
arise.
postpartum brain?
Postpartum brain, yeah. I don't know how long it's going to last, but I'm not at full capacity just yet.
Would you like to elaborate on?
Postpartum brain. So I just had a baby 4 months ago.
Oh, that's right.
And
you were gone for a while.
I was gone for 17 weeks, and my brain is under the trance of hormones. So I feel like I'm back to myself, but I'm not as quick as I used to be.
And
yet.
he's your second, right?
He's my second, yes, 4 months old, my Jackson. And I have a 2.5-year-old at home, Aiden. Neither one a redhead, believe it or not.
No.
Blondies.
And you have a big boy at home, too.
I do, my husband, Zach, yeah. A house full of guys, lucky me.
And a house full of guys in your clinic, too.
Yes, well, Gina.
Fortunately, a little bit of balance.
I have Gina, too, but yes, I'm lucky to have John and James with me. They balance it out a little bit.
So, let's see. Back to the serious stuff. Do your clients need a physician's referral for being treated?
Yep. And
for treatment.
That's usually the first question we get on the phone when Gina answers. How do we start a program? And talking to your doctor. And a doctor that's going to see you on a regular basis. That doesn't have to mean more than a year, but we like to send our paperwork to them So somebody that's going to follow you, not just out of the hospital, an attending or something like that. So usually your primary works, or a neurologist, orthopedist, depending on your
pain specialist.
Yeah, depending on what you're coming for, but somebody that knows you and would regularly follow up with you.
So I guess my question with that, so it doesn't necessarily need to be an ortho or pain specialist, but the one you're seeing the most.
Yeah, when people think about therapy, they think there has to be some big thing that happens, whether they break something or they have a surgery. That's not always the case. You might find that you're just weaker than normal, or for somebody like you, with back problems, something arises, maybe you walk too much and you just need a little tune-up, then you reach out to your primary care physician, and they're usually a great point.
Right, because I can't come in unless I have that referral.
We like to do things by the book here.
Right, and that's very good to keep us out of trouble.
Yes, we are ethical.
Lauren's department is very ethical and very by the book.
Yes, I was actually told earlier this week from a client that came from another therapy place that we are very thorough, and I like that word.
That's good, yes, very thorough. Because I could always tell the difference after a few weeks from when I could bend my back this far to when I could bend that far.
And that's how we know you're making progress.
And they do use a lot of heat and ice, which is very helpful.
Yes, which is usually people's favorite part of the therapy, because you're not in pain.
Remember the time after when the storm was coming?
The blizzard, yes.
The blizzard. I was going to go. Lauren kept me from making a dumb mistake.
You were the only patient we treated that day, and then we said, get on out of here.
Get on out of here. And I was going to go to the supermarket to grab something. And she said, are you sure? I got out the car. I said, no, I better listen to Lauren. And I went back home.
Thank God you did, because that could have been troublesome.
Yeah, it's always nice listening to other people.
You need us.
So how many different towns do your clients come from to receive treatment? Do you have any idea?
Most come from Clarence. When we've been talking about marketing aspects, we found that convenience is the #1 reason why people choose a clinic. But we've been getting a lot of clients from Akron lately, right down the street. But I really think it speaks to the Brothers of Mercy experience. We've had some people that have come from inpatient, maybe lived on Grand Island or Tonawanda or in the city of Buffalo, that enjoyed their experience so much they've actually driven all the way back for our outpatient. So the care they get in inpatient, especially the therapy department, really speaks volumes as to how we get patients as well. They want to stick with us, which is great.
And I know, and this isn't breaking any HIPAA, but I know we get people from our two-apartment independent living complexes.
Yes.
You get a lot of people from there, and nobody from Sacred Heart Home right now.
Not right now, but we have in the past, as well as Truer Woods, and even more importantly, our own employees.
Right.
Obviously, you are on campus, and we have treated from all of the buildings, so it's nice to get to know our team members and see where they're coming from and learn about their days and get to know more than just our normal work buddies.
Exactly. Is the therapy for your clients covered mostly by insurance?
Yes, we don't accept all insurances, but Gina asked that when you call. It's on our website too, but I would say a good portion of the therapy is covered by insurance. Sometimes there's a number of visits to limit that amount. We even had a lady that we didn't take her insurance, but she wanted to use our services so badly that she private paid. So that's an option as well, and that's at a discounted rate, and we take that into consideration. A lot of people that come to us, we try to have people come at least twice a week, but we are always mindful of the financial burden of paying a copay. So.
And the schedule, because I know there was times when a couple of the times I came here that I was only able to come once a week.
Yeah.
And so you said, okay, we'll pick up.
Yeah, we're open from 8 to 4 Monday through Friday, so especially with our employees, sometimes that's hard with a work schedule to get the right hours, but of course we'll make accommodations for our own. Twice a week is good. People sometimes ask for 3 times a week, but that's really an individual basis, and I know you can speak for this. Sometimes you're tired after therapy and you need a day or two of rest. If you do too much, we have people complain that they're too sore, it's too painful, and we're really not progressing forward. So 2 times seems to be enough.
Well, like you said, with the team members, with myself, it depends on how busy our schedule is that day.
Right.
If I have board meetings or whatever, and It's not all lost because they do give us a lot of exercises to take home with us and do at home on our off days.
Yeah, that was another point I was going to bring up, our home exercise programs. Once we feel you're good with the exercises and you're not going to cause more pain to yourself, we give you a little homework to do in hopes that you do it.
And you'll be happy. I haven't told you this in a while, but I've been keeping up with it at least
wow,
a
I'm
couple
really
times
impressed.
a week. So
You're one of the few. That's good for you, brother.
Yeah.
I'm impressed.
pat myself on the back for that one. Do you have goals for yourself or your department for 2024 that you would like to share? I'm sure you do.
Yes.
You're a very
I'm a goal-oriented lady, yeah. And just coming back, it's actually very refreshing. Being out for 4 months gives me a fresh set of eyes to look at things. The caseload was a bit lower than I would have liked when I was out, so it means we got to kind of get to the ground and hit the ground running on marketing aspects and getting the census up. So my goal would be to get a little bit busier and to try to find some new avenues to spread awareness about our clinic. I think we have a hidden gem in Clarence.
Please, everybody, keep her in her
We want everyone to know
team.
about it.
Yeah, we want her and her team to keep busy. I'm not worried so much about Lauren, but those guys in there.
Yeah, we got to keep the guys busy, or
Right.
you know, idle hands are never a good thing.
No,
But I have.
they're actually good. They're good therapists.
They're
I
excellent.
like to heckle them because they heckle back.
They do. And I think the biggest thing about getting new clients is the word of mouth. That seems to be our greatest asset. People have a great experience. They tell their friends, they tell their family, and that's how we get more people. So spread the word.
If you came across someone in the community and he or she asked you what they might love about working at the Brothers Mercy, what would you tell them?
I love the family atmosphere. Before I came to Brothers, I was a traveling PT living down in Georgia. And when I spoke to the gentleman that hired me, we were actually contracted out at that point. He told me there had been employees that had been here 30, 40 years. And I think that speaks volumes to when you work for a company and you stay for the longevity of your career. They must be doing
And
something
some of them are
right.
still here too.
Yes, and we have still many employees that have spent most of their careers here with us. And I think it's because it feels like home. It feels like family. We take care of each other. When we have clients come into the outpatient clinic, they're part of our family. We adopt everybody that we meet. We just
Right.
are one big happy family. And I think that makes you come back and actually enjoy working. So I like coming to work
Yeah,
every
because
day.
I know it's not true in the outpatient because you've only been open so long, but there's a few therapists in the inpatient clinic that have been here many years.
40 plus years, yeah, which is amazing. You don't find that too often anymore, especially nowadays. People flip-flop jobs, so the fact that we still
Yeah.
have those employees is excellent.
Okay, what hobbies or activities do you enjoy outside of work? That's if your boys give you time for hobbies, and
That's a loaded question, because yes, I'm a
those
new-
are probably your hobby right now, your boys.
They are. My little boys, and they're young too, so it's fun to spend time with them, and it's like having a full-time job when I go home. But as you know, and I think we share this hobby, I do love to travel. That's one of my big things. Zach and I are going to Bar Harbor, Maine next month for our anniversary.
Oh.
So we are still traveling when we can, thanks
So
to my
you have
mother
some
and
built-in
father-in-law.
babysitters.
Oh yes, my mother and father-in-law take the boys almost every weekend, so we have one day free, and that is just priceless. So we'll be
Fortunate.
traveling this summer. I scrapbook too a little bit. I haven't had much time to do that. I do enjoy photography, as do you, I know. I like
Must be a redheaded thing.
Must be. Trying to get back working out, trying to lose the baby weight, so I do have a passion for that when I can find the time. But I'm a busy mom right now, so that's what I'm devoted
Well, you
to.
have some good equipment in your clinics.
I do, and I work out on my lunch break, so I'm lucky in that aspect.
And I know from a fact of either seen or hear about it, I know if I've gone like the first client and they're after lunch or before lunch, I know that the therapists have been working out during lunch, or I'll catch them in action.
We're
doing
the
some-
exercise people. We actually,
Yeah.
most people don't like to exercise. That's our bread and butter. So we got to practice what we preach. If we're telling other people to exercise, we have to do
Right.
it too. And it's good. It's good to stay active.
Oh, and one thing I like, because I've been other places for therapy, and it seemed like there was just, not to knock them, but it was like a mill.
Mm-hmm.
But you get, at our outpatient therapy clinic, you get more one-on-one. As a matter of fact, I know when I was there a couple times, I had more than one set of eyes on me. and I'd hear somebody say, Lauren, brother's not doing that right. And I'd say, thanks for the help.
Yeah, we love the open concept of the gym because, like you said, there's always eyes watching, but that's a good thing because we can correct your form and make sure you're not going to re-injure
Right.
yourself.
And so I don't want to scare people away. That is actually a good thing that there's other therapists kind of when they're working with somebody, they glance over and kind of helping each other check.
I always tell people when they come in, I've had a couple evaluations this week, you might not just work solely with me. We like to interchange
Right.
patients so we get to know everyone. That way, you know, if I have a day off, James can just swoop on him. So
Well, and I think it helps change the routine a little bit just so we don't get stale with our workouts. And but I also do like, not just for the fact that I'm a brother and it's Brothers of Mercy, but I do like the one-on-one, because I know where I've been places where you have one therapist and they're going around, oh, hold on a minute, I'll be back, I have to see this person, I have to see this person, so, and I would be done with the exercise sitting there waiting for them.
and your time is just as valuable as ours. So yeah, when you get that one-on-one treatment, you build a rapport. We can have conversations while you're exercising. What's causing pain? Did you go on too long of a walk? Were you sitting in the car for too long on vacation? And we start to kind of problem solve together where you just don't have that at other clinics.
Or, brother, don't do that anymore.
Yes, yes. If somebody is a little rogue, we can kind of rein it in.
Well, and I did learn because there's, if anybody knows the campus and the path from the Brothers residence over to the front of the nursing home, it goes around the old, what we call the BOM Center now. A lot of it's paved, but some of it's grass. And for a while there, I was in the winter, I was walking across in the deep snow, and Lauren saw me, she said, brother, you shouldn't do that. So in the winter,
The therapist's mind never turns off. We
Right.
watch
In the
you
winter,
walk
I need
outside
to-
before you come in.
even though it's only around, I drive the car
Yeah.
to protect myself, and that's things
Safety.
that Lauren and her hawk eyes keeping an eye on me.
Yeah, we watch out the window. We see everyone coming down the hill. We don't want to watch her roll down the hill.
Right, and the weather, and they don't want to have to come up
Or
and try to
slip.
pick me up.
No, that wouldn't be a good
Yeah,
day
it'd take
at work.
about 3 of them to pick me up.
Oh,
So,
well, we don't want that to happen.
No.
So behave yourself.
and yes, and so the weather's nice now, and the grass is dry, so I could
Walk
walk
around
across
wherever you
the
want.
grass as much as I want.
Yeah, you're free now, but
Yeah,
in the
even
winter.
in the winter, if the weather's not bad, I could do that. But
And I like that you walk. That is a good exercise. Just it's a simple. We all can do it if we still can walk on our two legs. That's a start for anyone wanting to work out.
just
so.
on 6 inches of snow.
No.
And that, because that grass, a lot of the campus gets plowed, but as Aaron and I both know, that grass does not get plowed in the winter, so.
Yeah. Use your best judgment. I
Use
think
your-
that should
yep.
be your little token of.
And I said, what a concept, but,
You listen though. That's the
Yeah.
good thing. Not everyone listens.
yep, and that's not only, and I have to put this plug in, not only with your therapist, but with your nurses, your aides, be compliant. There's
Yeah.
nothing worse to healing or getting better than people that don't listen to their medical providers.
You know, we're the worst patients though. When
Yeah.
you work in healthcare, you're not a good patient. We just think we know everything.
You're just
Lis-
lucky
listen to the
that,
professionals.
just not lucky that I never have to take care of you.
Oh goodness. I don't know how that would go.
But anyway, Lauren, it's been a pleasure, and I know we would have a great conversation.
Always a pleasure.
I shouldn't say this, but I always joke around with her, telling her she's my work daughter, and someday she's going to donate some of that hair to fill these patches. But just a running joke we have, and
For years.
yeah,
Yeah.
she keeps growing it longer and longer. So
Yep. Someday. It'll
Someday.
be yours.
yeah, someday maybe when I'm not in my right mind, you could.
Okay. No,
But anyway, it was nice talking to you. I know you have a lot to do for the rest of the day.
thanks for having me, brother. I appreciate it.
You're welcome. It's nice to see you again, and nice to have
Always
you
a
back.
pleasure.
So everyone, please stay tuned for our next interview coming up in the next few weeks. And so until then, goodbye from the Campus Conversations with Brother Ken.